Call the meeting to order. Today is October 9th, 2024. It's a Program and Budget Committee. Let's start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now a reading of the mission statement. Who would like to read the mission statement? Go ahead, Donna.
Okay, Okay. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Donna.
You're welcome.
Number 3, adoption of the agenda. Is there a motion to adopt the agenda?
So moved. Support.
Motion by Megan, support by Wayne. All in favor signify by saying aye. Aye. Motion carries. Item number 4, hearing of the public. Now is the time for someone from the public to speak to this board. Is there anyone in the public looking to speak to the board? Thank you. Item 5A, request to approve residential lease A, and is there a motion?
Support.
Motion by Selena, support by Megan. TJ, could you talk about this one for a minute?
Sure, I'd be happy to answer any questions you might have.
Okay. Does anyone have any questions? All right, well, it's already been proposed, and there's a motion. All in favor signify by saying aye. 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 Motion carries. Item 5B, request to approve residential lease B. This has also been approved by legal. Is there a motion? Motion by Linda, support by Mark. And Wayne? Mark got this one. I got the last one.
That's okay.
Any questions on this one? No questions on this one. All in favor, vote by signify by saying aye. Aye. Motion carries. Thank you, TJ.
You're welcome.
Here's item C, which is Tracy or TJ. Request to approve the renewal of a sublease for the MyCare space located at the north location. Is there a motion? Motion by Donna, support by Mark. Tracy, TJ?
Happy to answer any questions.
Okay, does anyone have any questions? No questions. All right, no questions. Please signify by saying aye. Aye. Motion carries. Oh, I forgot to ask, any opposed? Motion carries. Item 5D, request to approve Milliman engagement letter for fiscal year 24-25 in the amount of $20,000 to $22,000, and it's approved by legal. Is there a motion? Motion by Antoinette, support by Donna. Oh, the other way around. Okay. Tony, do you have a?
Yeah, just a couple points. As we know, this is a requirement in our analysis from our last one with all these conversations around the ISF was critical. So this is a renewal to have an updated ISF analysis prepared by Milliman.
Thank you, Tony. Does anyone have any questions for Tony? No questions. Please vote by signifying aye. Aye. Motion carries. All right, thank you. Item 5E, request to approve a CMH SOW Master Service Agreement in the amount of $151,515. Is there a motion? Motion by Antoinette, support by Lori.
Hi everyone. So this is Afia. We've been using them for the last 3 years. They help us with our data warehouse and collecting our data and forming our reports. Any questions for me?
Does anyone have any questions? No questions? All in favor, vote by signifying aye. 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 Any, all opposed? Motion carries. Thank you. All right, item 6, receive and file. We have nothing to receive him. Oh, Item 5F, request to approve MISD Early On Preschool and Assessment Center Services, approved by legal. Is there a motion?
Support.
Motion by Megan, support by Wayne.
Once in a while.
Heather, do you have anything to add to this one? Helen, I'm sorry.
No problem, yeah. Just to let you know, this is a renewal. It's a very small grant, but it does allow some funds to kind of offset some cost. And so we provide a case manager. They meet monthly with the early on team and, help coordinate different services for families. We serve about 30 students, children through the year on this one.
Any questions for Helen? No questions. All in favor signify by saying aye. Aye. All opposed? Motion carries. Item 6, receive and file. There's nothing to receive and file. Item 7, there are no resolutions. Item 8, other possible agenda items. CEO update.
So my CEO update is, I'm actually going to pass it to Helen. The reason why is I'd also officially like to announce that Helen, as of September 30th, is our new COO. One of the reasons why I'm passing it to her, also on September 30th, so she was thrown into the action, and I am missing one organ and much more spunky than before, so she literally was thrown into it, and between Richard jumping in and doing a ton of great work, and Helen and Sandy covering while I was out, I just want to express my deepest appreciation and also reassure you that we do have an amazing team, and they were able-bodied in order to jump in while I was not physically able to assist. So thank you and congratulations to Helen, and she's actually going to give the update.
Great. Well, thank you so much. Very happy to be in the new position officially now. So thank you, everybody, for your kind words. Really appreciate that. Just a few brief updates. I know I saw a few of you at the clubhouse. 31st, right? Anniversary celebration on Friday last week. So as always, they did a great event, very well attended. They were able to raise $4,000. And that was wonderful because they do that through their raffles and different events that they have going on there. And they use that money to help pay for like their Thanksgiving dinner that they do and their Christmas breakfast that they do and some different little things throughout the year. So it was really well attended and a very nice event. So if you don't make it out, I'm sure they're going to do another one next year. So, there's always an opportunity. The other is, you may have heard us talk about before, but for the new fiscal year, so starting in October, the state was having us change the type of assessment tools that we use for our assessment of children. And so we were moving from our standard assessments we had done for many years over to the Michigans, they refer to it as. And so we were really on top of it, on board. We got our network trained up and ready to go. And at the very last minute, they sent out a Medicaid bulletin saying they did not get CMS approval yet. So all that just went on hold. We're back to doing the assessments we had done before. So it was all in the system. We got it all turned back on and in place. But just in case, you hear, oh gosh, something was changing and then it didn't change. It's still coming. We'll get it in place again soon as the state gets their approval, but we're back to using the ones that we had. So great for our team to be ready. So that was good to be ready to go, but it just wasn't able to occur. The other, we're still waiting to hear back from the state on the contract. So we are, actively still pursuing that with them, along with the other 6 regions. So the contract that we submitted with our, red line through and signature, the state said they weren't in agreement with, they weren't going to accept. So we're waiting to hear back more on that. Richard was helpful in Tracy's absence and being able to attend a couple meetings on that. So we're waiting for our correspondence back on that issue in the meantime. That's what I have for today.
Thank you. Any questions for Helen? Thank you, Helen. Item 5B, a reminder, the Recipient Rights Advisory Committee meeting is October 17th at 8 o'clock. Also a reminder, full board, Wednesday, October 23rd at 6 o'clock. Item 9, are there any providers from the in the audience wishing to speak? No provided, anyone from the public? Item 10, anyone from the public looking to speak? All right, then, item 11, adjournment. Is there a motion to adjourn? Motion by Megan, support by Wayne. All in favor, signify by saying aye. Aye. Motion carries. We are adjourned. Yep, I think.
And don't go anywhere.
Oh, don't
We can't start the next meeting till 6:30, so you get a 20-minute break.